As we wait for scientists and healthcare professionals to develop a vaccine for COVID-19, social distancing has been described as one of the best measures we can take to prevent the spread of the virus, or at least flatten the curve. However, as the number of infections reaches 1 million worldwide, patients hardest hit by COVID-19 will need to be placed on ventilator machines. The need to increase the development of ventilators and other medical devices has spurred the worldwide 3D printing industry into action. We have explained in our previous video how the 3D printing technology has been on the verge of a breakthrough. As 3D printers can be easily repurposed to manufacture low-cost medical equipment, health authorities around the world are asking companies to repurpose their production lines and supply chains as they try to close the huge gap between the number of ventilators that will be required and the number currently available. The idea of 3D printed components originated in Italy, where hospitals were running out of emergency ventilator masks. Dr. Renato Favaro realised that by adjusting a snorkeling mask already available on the market, they could 3D print valves to make the necessary modifications. However, the ventilator manufacturer was unable to share the CAD files due to medical regulations. He contacted a 3D printing company, Isanova, who studied the idea and reached out to sporting goods company Decathlon, which makes the Easy Breathe snorkeling masks in question. Decathlon provided the CAD drawings of the snorkeling mask, to which a new component was designed and 3D printed by Isanova. The new repurposed ventilator mask is able to provide vital airflow to avoid the collapse of patients' lungs. Isanova went one step further and patented their connecting component called Charlotte Valve to be sure the design is kept free. If you happen to have a 3D printer at home, you can use the files to print the valves yourself. You can find the link to the files in the video description. It's reported that 500 patients are now being treated using the modified mask. Thanks to the success in Italy, the concept of 3D printing medical parts and equipment has now been embraced by other countries as well. Many hospitals around the world are incorporating 3D components to their own specialised medical equipment. Desktop Metal, a 3D printing company, has launched a site for manufacturers to submit requests for metal components needed for medical devices amid the supply chain constraints. They will be able to access the technology and engineering resources in order to provide free 3D printing services. In recent weeks, doctors and nurses have also reported shortages of personal protective equipment. Stocks of N95 type masks and antimicrobial filters are only available in small amount. This was evident in New York, the current epicenter of the US coronavirus outbreak. This is where another 3D printing company has stepped in, Copper 3D. The company, which specializes in antimicrobial equipment, has released 3D printing files to allow anyone with a printer to make its nano-hack mask, designed to filter out particles that could carry the virus. 3D printing is not the only technology that is helping the coronavirus fight. We can use artificial intelligence as well, but more on that in another video. Thanks for watching. Did you like this video? Then show your support by subscribing, ringing the bell, and enabling notifications to never miss videos like this.